Hi, my name is Jean Elwing, and I'm from the University of Cincinnati in Cincinnati, Ohio.
Hi, I'm Vijay Balasubramanian. I'm a pulmonologist from Fresno, California. My practice is called Valley Advanced Lung Diseases Institute.
I am Alejandro Cruz-Utrilla from the Spanish Reference Center in Pulmonary Hypertension in Madrid, Spain, Hospital 12 de Octubre.
I'm Patricia George. I'm a PH pulmonologist from Denver, Colorado at National Jewish Health. I wanted to talk about a few topics that are top of mind today. One is this concept of risk stratification. And we hear about it a lot in clinic. Certainly as physicians, we talk about it a lot. But Jean, could you explain to patients what risk stratification means or what they should take from that?
Oh, absolutely. So, of course, we all know it's so important. It helps us understand how our patients are doing at that time. But what does it mean to a patient? So when a new patient sees us, we want to evaluate how they're doing in terms of their pulmonary hypertension. And in groups of patients that would be like them, how likely would they get in trouble in that first year after they were diagnosed? And that tells us how hard we have to push to get them to where they need to be and how they want to feel. If we do this right, and we treat people the way they need to be treated, given them all the opportunities in terms of medications, we can take somebody from a high-risk status to a low-risk status, which is associated with very good outcomes and a very treatable, controllable situation.
And one of the things, speaking about that I am super excited about, even before the meeting, I'm sure a lot of our listeners are aware of the news that we have a new medication in this space. We have more arrows in our quiver, so to speak. Vijay, can you talk a little bit about that?
Just rewind back about 30 years ago, we had no treatments for this condition. And then came one, and then we had 3 pathways for about almost 2 decades. And now we have a 4th pathway. 4 different pathways that complement each other, and they're totally different. And this exciting new drug has actually shown impact on patients who've been on all 3 drugs. Overall, this is very good news for our patients. Obviously, we will learn more in due course about the efficacy of this drug in the real world, but I think it's a great start.
Can you speak a little bit about your approach as a physician when you have a patient sitting with you, you've made the diagnosis of Group 1 pulmonary arterial hypertension, we call PAH. What is your approach in getting people initiated on medical therapy?
My first approach is to make sure that the patient has some support system along with the patient, because sometimes this could be a little too complex for one person to understand. So it's what I have done in practice is to actually have the patient accompanied by family or friends whom they wish to be a part of their healthcare. Make them understand, like how Jean was talking about, where they are in this. And then start setting up expectations and then tell them, this is the playing field, these are the medications available, and these are some of the pros and cons. It's a process. Jean, how would you approach this situation?
I agree 100%. It has to be an open dialogue. And you have to have the tools in your toolbox. You've got to understand what you're talking about, understand your risk, and then understand the risk of the medication.
I couldn't agree more with your approach. It's the same here. I think we should talk with patients directly, face to face, and talk about everything, about the expectations, the possible treatment options, and the possibility of having a not so good disease. And of course, we are talking not only about treatments, about pills, about IV or subcutaneous prostacyclins, but we are talking also about oxygen therapy, about rehabilitation.
One of the things when I see patients in clinic that I also try to get a little more concrete with them on is, what are their goals? Like, we can talk about 6-minute walk distance and echo and BNP and these lab values, which is what are some of the tools we use when we see people every 3 months or however frequently we're seeing them, right? To are you getting better? And of course, most importantly, how do you feel and what can you do? What we call functional status. In the bigger picture, what's their goal? Like, do they want to be able to walk from their car to the soccer or football game, right, and watch their grandkids play? Like, can they not do that now? Depending on where people are, where do they want to go? What does feeling better look like to them so that they have that vision? We actually have on our LearnLiveBreathePH.org website a little worksheet for people to fill out saying, you know, they can write down their questions to take to their doctor in their next visit, and also what their goal is, like how do they want to improve or feel better. We're here today at this point in the field because of the wealth of medical research that we've had and clinical trial work. And I wonder, Alejandro, if you can speak a little bit about clinical trials, how that works in your practice, and your approach with patients.
Still, the disease is, it has no cure. For when you talk about the 30-year journey of treatments, we have still work to do. When we have triple or double therapy, we offer clinical trials because it's something we can offer them in an attempt to ameliorate their disease. We live now in a very good time for clinical trials in PH.
Absolutely. While we've just had announcements of 2 new medications in the United States that have just recently became available, there are more in the pipeline.
Yeah.
I mean, there are clinical trials ongoing now that are very exciting with these new molecules. I mean, this is a pretty hopeful time for us.
So as we wrap up, if we could, in 2 minutes or less, give our audience the key takeaway messages from our talk today. Jean.
I would say, know your risk status. Understand where you are in terms of your illness and where you want to be.
Vijay.
Let me start the same way. Know your treatment. Know your expectations. The patient who's going through this condition is at the center, and he or she can determine what are their individual expectations. This is what we refer to as shared decision making.
What about you, Alejandro?
I would say to my patients, feel free to ask your doctor what clinical trials are ongoing on your side.
Well, thank you all again for participating today. This has been great. It gets me excited about where we are in the field, and I look forward to our last day of Symposium tomorrow.